If you're over 60, I want to show you something simple, something most people overlook. And the dangerous part, it could quietly raise your risk of having a stroke while you sleep. There are no early warning signs. One moment, you're chatting with your spouse or watching TV. The next, you might suddenly lose the ability to move your arm, speak clearly, or even stay balanced. My name is Dr. Mark Ellison. I'm a neurologist, and I've seen this exact scenario play out more times than I can count. What troubles me most is this. Many of the people I've seen in these situations weren't careless with their health. They ate well. They didn't smoke. They didn't drink. Some of them even exercised regularly. And here's the surprising part. They genuinely cared about their health. They took vitamins every day. But that's exactly what I want to talk to you about. Some vitamins, if taken at the wrong time, especially at night, or taken in high doses over a long period, can quietly raise your blood pressure, interfere with blood flow in the brain, and increase your risk of stroke or brain bleeding while you sleep. Not everyone is affected, but the risk is real, and it's rarely talked about, even by doctors. In this video, I'll walk you through 9 common vitamins that many people take every day, without realizing they could be silently harming their brain. I'll also share safer, more effective alternatives, so you can continue supporting your health without making risky mistakes. My goal isn't to scare you. It's to give you clear, reliable information, so you can take charge of your health and make smarter decisions after 60. Vitamin D plays a vital role in maintaining bone health and helping your body absorb calcium, especially as you get older. But many people believe that more is better, and that mindset can lead to serious consequences. When you take high doses of vitamin D, more than 4,000 IU per day, especially in the evening, your body can end up with too much calcium in the blood. This condition causes calcium to build up in the blood vessel walls, making your arteries stiffer and narrower. As a result, blood pressure goes up, blood flow to the brain is reduced, and your risk of stroke during sleep increases significantly. I remember one case clearly, James, age 74, from Minnesota. He didn't have any major health problems. He walked every day and ate fairly well. Wanting to keep his bones strong, he decided to take 10,000 IU of vitamin D every morning on his own for nearly a year. At first, everything seemed fine, until one morning he woke up with a drooping mouth and slurred speech. The diagnosis: a stroke caused by vitamin D toxicity, which had led to dangerously high blood pressure while he was asleep. Here's my advice for anyone over 60. Unless your doctor gives you a specific reason, stick to 600 to 800 IU of vitamin D per day and take it in the morning. Your body still needs this vitamin, but taking it at the wrong time or in excessive amounts can do more harm than good. Vitamin E is often praised as an antioxidant that supports heart health and memory. And that's true, but only when it's used in the right dose and the right context. When taken in excess, especially over 400 IU per day, vitamin E can thin the blood more than it should. That becomes dangerous for people who are already on blood thinners like warfarin or even over-the-counter aspirin. I once had a patient, Margaret, age 81, from Arizona. She had a history of atrial fibrillation and was prescribed warfarin to manage her blood clotting. Around that time, a friend told her vitamin E was good for the heart and brain, so she began taking 800 IU daily on her own. A few weeks later, she was rushed to the emergency room with a severe headache, blurred vision, and slurred speech. A brain scan showed she had suffered a brain hemorrhage. No trauma, no high blood pressure, but the bleeding happened because of the combination of high-dose vitamin E and blood thinners without any medical supervision. Here's the takeaway. If you're taking any kind of medication that affects blood clotting, even something as common as aspirin, do not add high-dose vitamin E without first speaking to your doctor. For those of us over 60, the goal isn't to take more, it's to take things the right way. Vitamin B6 is commonly found in supplements marketed for memory support or relief from numbness and tingling in the hands and feet. In theory, it's an important vitamin for healthy nerve function. But when taken in high doses, specifically more than 20 mg per day over a long period, it can lead to nerve toxicity. This can damage the protective covering around your peripheral nerves, causing muscle weakness, numbness, balance problems, and in severe cases, difficulty walking. I once saw a heartbreaking case. Donald, age 76, from Ohio. Hoping to improve his memory and ease the tingling in his legs, he started taking an over-the-counter brain supplement he found online. Each pill had 200 mg of vitamin B6. He took it daily for a full year without realizing he was far exceeding the safe limit. By the time he came in, he had lost sensation in his hands, was unsteady on his feet, and had fallen several times. The nerve damage at that point was serious and not fully reversible even after stopping the supplements. Here's the advice. Always check the amount of vitamin B6 in any supplement you take, even if it's over the counter. If your total daily dose is more than 20 mg, stop and speak with your doctor. Vitamin supplements shouldn't be taken based on guesswork. They require clear information and guidance, especially as we age and need to protect our nervous system more than ever. Vitamin A has long been known for supporting vision and skin health. But what many people don't realize is that it's a fat-soluble vitamin, which means your body can't flush it out as easily as water-soluble ones like vitamin C. When taken in high doses over a long period, vitamin A can slowly build up in your liver and fat tissue, and that buildup can eventually affect your brain. I once treated a patient named Lorraine, age 79, from Oregon. She didn't have any serious health conditions. She simply wanted to take better care of her eyes as she got older. For 5 years, she took an eye supplement that contained 10,000 IU of vitamin A every day, a dose many people assume is still within the safe range. But over time, she began experiencing troubling symptoms: constant headaches, blurred vision, dizziness, and slurred speech. After a thorough exam, she was diagnosed with pseudotumor cerebri, a condition that mimics the effects of a brain tumor and can lead to permanent vision loss if not caught in time. Here's the recommendation. For adults over 60, your total daily intake of vitamin A from food, eye supplements, and multivitamins should stay between 2,500 and 3,000 IU. If you're taking anything for eye health, be sure to read the label carefully. And if you have any concerns, talk to your doctor before continuing long-term use. Niacin, also known as vitamin B3, is often promoted as a natural way to help lower cholesterol. Some older adults choose to take niacin in hopes of avoiding statins, the common cholesterol-lowering drugs that can sometimes cause side effects. But at high doses, over 500 mg per day, niacin can cause sudden dilation and then constriction of blood vessels. This rapid shift can make your blood pressure swing wildly, raising the risk of irregular heartbeat, mild strokes, or feelings of dizziness and heart palpitations. I clearly remember one case, Charles, age 82, from North Carolina. He decided to take 2,000 mg of niacin every day on his own, hoping to manage his cholesterol without using statins. At first, he experienced facial flushing and redness, common side effects that many people dismiss. But after a few weeks, he started feeling unusually tired, noticed his heart racing, and one morning he suffered a mild stroke while making breakfast. Doctors later found no major artery blockage, but they did identify a sudden spike in blood pressure that morning as the likely cause. Here's the advice. For older adults, if your total daily niacin intake goes above 50 mg, it should be closely monitored by your doctor. Even no flush or slow release forms of niacin can sometimes harm the liver or fail to deliver the benefits you're expecting. Don't rely on marketing claims. Rely on guidance from a qualified healthcare provider. Compared to well-known vitamins like C, D, or E, vitamin K doesn't get talked about much. But if you're taking a blood thinner like warfarin, vitamin K becomes extremely important, not because it's harmful by itself, but because it directly affects how your blood clots. When the amount of vitamin K in your body suddenly changes, whether from food, supplements, or multivitamins, it can throw off the balance of your blood thinner. If your blood gets too thin, you risk internal bleeding. If it gets too thick, clots can form, raising your chances of stroke or a blocked artery. I once worked with a patient named Helen, age 84, from Pennsylvania. She had been taking warfarin with a stable INR for months. Then, she switched to a multivitamin designed for women over 80, which contained 120 mcg of vitamin K. Around the same time, she also added more leafy greens to her meals. Within just a few weeks, she suffered a mild stroke caused by faster than normal blood clotting. It wasn't that the new supplement was bad. It was the sudden jump in her vitamin K intake that went unmonitored. Here's the takeaway. If you're on blood thinners, you don't have to avoid vitamin K entirely. What matters most is keeping your intake consistent day to day, from both food and supplements. And any changes to your diet or supplement routine should be discussed with your doctor so your medication can be adjusted safely. Folic acid, also known as vitamin B9, is often found in memory support supplements, especially those marketed to older adults. In reasonable amounts, it can be beneficial for brain health. But here's something many people overlook. Taking high doses of folic acid without also checking your vitamin B12 levels can mask a B12 deficiency, and that can lead to serious nerve damage, often mistaken for signs of dementia. I once treated a patient named Linda, age 70, who came in because she was repeating herself, forgetting appointments and speaking in ways that didn't always make sense. She told me she had doubled the dose of her memory supplement, hoping to stay sharp. Each pill contained 800 mcg of folic acid, but her blood work revealed something concerning. Her vitamin B12 level was extremely low, to the point where it was clearly affecting her nervous system. She was starting to lose her balance and showing signs of cognitive confusion, not due to aging, but because of prolonged B12 deficiency that had gone unnoticed. Here's the advice. Don't take high doses of folic acid unless your doctor specifically recommends it. And if you're using any memory supplements that include vitamin B9, make sure to get your B12 levels checked regularly, especially if you notice symptoms like forgetfulness, slowed speech, or balance issues. Catching a deficiency early can help reverse the damage. But if it goes on too long, the nerve damage may become permanent. Vitamin C has long been considered a safe go-to for boosting immunity and fighting off colds. But here's something most people don't realize. At high doses, around 1,000 to 2,000 mg per day, vitamin C can be converted into oxalate, a compound that can crystallize and settle in the kidneys. For older adults, especially those with declining kidney function, this can lead to kidney stones, electrolyte imbalances, and in some cases, chronic kidney damage. I remember one patient, Richard, age 79, from Colorado. Every morning, he drank 2 packets of a popular immune booster powder, each containing about 1,000 mg of vitamin C. At first, he felt more energized. But after a few months, he began having dull back pain, frequent nighttime urination, and unpredictable blood pressure swings. Tests showed that his kidney function had declined, and there were signs of oxalate buildup, a possible consequence of taking high-dose vitamin C over time. Here's the advice. Adults over 60 usually only need about 75 to 90 mg of vitamin C per day, an amount easily met through foods like leafy greens, oranges, strawberries, or bell peppers. High-dose supplements should only be taken if there's a clear medical reason and under a doctor's supervision. Don't let the safe reputation of vitamin C fool you. especially when your kidneys and blood pressure deserve extra care as you age. Magnesium is a mineral many older adults turn to for better sleep, muscle relaxation, or relief from constipation. It's true, magnesium is essential for healthy nerve and heart function. But when taken in high doses, especially in fast-acting forms or alongside blood pressure medication, it can cause blood pressure to drop too low. This may lead to dizziness, muscle weakness, irregular heartbeat, and in some cases, problems with coordination or movement. I once saw a patient named Stephen, age 77, from Nevada. He was taking magnesium citrate to help with insomnia and constipation. At first, it seemed to work fine. But after a few weeks, he started feeling unusually tired, lightheaded when standing up, and noticed irregular heartbeats. Lab tests showed his magnesium levels were elevated, and his morning blood pressure readings were consistently low enough to raise concern. The combination of high-dose magnesium and blood pressure medication had thrown his system off balance, and he had no idea it was happening. Here's the advice. If you're over 60, be cautious when taking magnesium supplements, especially if you're on blood pressure meds, diuretics, or have a history of heart issues. Most people can get enough magnesium through foods like nuts, leafy greens, or whole grains. If supplementation is needed, it's best to start with a low dose and always consult your doctor, rather than relying on guesswork or unverified advice. After learning about 9 familiar vitamins that can be harmful if misused, many people understandably ask, so what should I do? If I stop taking everything, how do I protect my heart, brain, and overall health? The answer is this. After age 60, your body doesn't need a long list of vitamins. What it truly needs is the right kind and the right amount. It needs balance. It needs consistency. And above all, it needs you to listen to your own body, not to every online trend or flashy ad. I remember a patient named Elaine, age 73, who came into my office carrying a large Ziploc bag filled with pills. Bone support, brain support, sleep aid, energy booster, skin vitamins, antioxidants, you name it. Yet she still woke up tired every morning. She felt unsteady getting out of bed, mentally foggy, forgetful, and had trouble focusing. After a careful review, we decided to simplify everything. Instead of adding more, we focused on removing what wasn't necessary. Her new plan was refreshingly simple: a light breakfast. 1 boiled egg, half an avocado, a slice of whole grain toast, a few blueberries, and a glass of water. A gentle lunch: leafy green salad with walnuts and grilled salmon. Daily movement: light stretching in the morning, a 15-minute walk after dinner. Quality sleep, enough hydration, and no pills unless they truly served a purpose. 6 weeks later, she returned for a follow-up and said something beautifully simple. I feel better than I have in years. It's a kind of health I didn't know I was missing. After turning 60, what your body truly needs isn't a shelf full of pills. It's a return to the basics. The simple, clear, and proven things that actually make a difference. Here are 5 solid foundations every health plan should start with. 1 real food. You don't need a multivitamin. What your body craves are real meals: leafy greens, fish, eggs, nuts, and fresh fruits, not orange powder in a fizzy packet or shiny capsules. Whole foods provide nutrients your body can absorb more efficiently, without putting stress on your liver, kidneys, or digestion. 2. Water. Mild dehydration is extremely common in older adults and often goes unnoticed. Drinking 6 to 8 cups of water a day can improve alertness, support joint mobility, and help keep blood pressure stable. If you often feel tired for no clear reason, start by checking how much water you're actually drinking each day. 3. Gentle daily movement. No need for a gym membership or long walks. Just keep moving. Walk around the house, stretch when you wake up, garden a little, or take a short stroll after dinner. After 60, your body doesn't need speed. It needs consistency. Daily motion helps maintain strength, balance, and overall well-being. 4. Steady sleep habits. Good sleep doesn't come from a bottle or a high-dose supplement. It comes from routine. Go to bed at the same time each night, turn off screens early, avoid blue light, and wind down with a book or soft music. A full night of restful sleep is one of the best gifts you can give your brain and immune system. 5. Daily connection. Spend a few minutes each day talking to someone, family, a friend, a neighbor, or someone you trust. Just 5 to 10 minutes of connection can make a big difference. Social interaction lifts your mood, helps preserve memory, eases loneliness, and gives you a reason to look forward to each day. After 60, the body doesn't bounce back the way it used to. Everything we take in, whether it's a meal, a supplement, or a daily habit, has a more noticeable impact. That's why taking care of your health at this stage isn't about doing more. It's about knowing what truly fits your needs. I hope today's video helped you take a closer look at the vitamins you're using and ask yourself, do I really need all of these? Every body is different. What works for someone else may not be the right fit for you, and there's nothing wrong with taking your time to figure out what truly works for your own body. If something in this video made you stop and think, I'd love to hear from you in the comments. What kind of vitamins are you currently taking? Have you ever felt tired, dizzy, or off balance without knowing why? Your story might help someone else who's watching and wondering the same things. If you found this video helpful, feel free to hit the like button to help spread the word. And don't forget to subscribe if you'd like more clear, practical health tips for life after 60. From memory and sleep to simple, effective ways to eat well and feel better. Thanks for spending your time with me. I'll see you in the next video.